The most important video regarding the INICET exam are the INICET previous year topics. So hello everyone, I am Dr. Mayukh Hazra and I am bringing you all the 10-year previous year topics of INICET exam. In these notes, which are highlighted, have come 2 to 4 times, and which are bold and given VVI with the highlighter, they have come more than 5 times. This shows the gradation and importance of each topic. अगर कोई टॉपिक बोल्ड में लिखा है मतलब 2 से 4 बार आई है, सो वो वाला टॉपिक ज़्यादा चांसेस है आने का, एंड अगर वो बोल्ड में है तो उसका चांसेस और भी ज़्यादा बढ़ जाता है. दिस PDF I had released before the INICET November 2024 and 151 questions came from this list only. And now I have incorporated all the November INICET 2024 topics also in this PDF. For anatomy, the most important part is the neuroanat, and here the base of the skulls, which all foramina are responsible for exit of which nerves, is important. Terion, though, I have given the example also of Terion, how it was asked in NEET PG versus INICET video. Blood supply of brain is very much important. Branchial arches. After that, the holocrine gland. The holocrine gland image was given many times in histopathology, and that was only asked. If you think that this video is going to add some value to your preparation, then do subscribe if you are new to my channel. In physiology, 6 to 10 questions are asked, and it is an average weighted subject. General physiology is more important for the INICET's perspective. The titanizing frequency has come n number of times. They would give you a graph like this, and below that the frequency grading would be done. So this is the contraction time, and 1 by contraction time is the titanizing frequency. So from here we can see that 3 hertz is coming. So 1 by 3, it would come to be 33.3. In CVS respiratory system, oxygen dissociation curve is important. FRC and the minimum volume graph was asked in my year INICET, and I did a mistake in that. CNS, the sleep cycles are important. Most commonly, the REM sleep is only asked. GFR and the factors influencing GFR is very much important. GIT hormones, they give match the following or how many statements are correct. Biochemistry is high weightage, 10 to 15 questions are being asked, and the main focus is on molecular biology. Okay, the genetics part is hot favorite of INICET, and also the disorders related to the metabolism like the glycogen storage disorder or hyperlipoproteinemia, Repsum disease. These all are important. In miscellaneous, vitamins are important, but vitamins are more important for the NEET PG aspect. Pathology, very much high weightage, and in INICET the pathology that they focus is based on the internship related topics like the stains if you do the pathology posting, the vials if you do the ward postings, and blood transfusion also if you do the medicine ward postings. Stains is very much important. Coagulation pathway is important. The genetics part is hot favorite of INICET, so here also the genetics part takes a lot of priority. Hematology, Hodgkin's lymphoma, always. Nodular predominant, popcorn cells, these are asked. What are classical Hodgkin, which is non-classical Hodgkin, this is asked. Iron metabolism, iron profile is very much important. As I said, that the blood transfusion, blood storage, and the vials are the most important. In systemic, lung cancer is a bit important, and schwannoma histopathology, it was given 4 times, the Antony A, Antony B, and the Verroque bodies. Pharmacology also 15 to 20 questions on an average it comes. As INICET is more focused on the pre and paraclinical subjects, these subjects have a high weightage. General pharma is important, mainly the clinical trials and drugs which have teratogenic potential. Monoclonal antibodies is very much important. Approximately 2 to 4 questions at least will be asked in the INICET exam. And for that, monoclonal antibodies notes is available for free, and for that purpose my monoclonal antibodies notes with previous year questions annotations is available for free. You can check in the description box below. The antimicrobials is very much important for the INICT aspect. The antitubercular drugs, ARTs, and the side effects are very much important. In endocrine, the SGLT2 inhibitors are very much important. It was asked many number of times up to 2022, but now a bit of less frequently it is being asked. In 2 years it has not come. CNS lithium बहुत ज़्यादा important है. After how much time of the first dose you will do the serum levels of lithium? What are the serum levels of lithium for acute mania and all? What are the common side effects of lithium? So lithium, 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 as INICT is focused on a particular previous year topic. Miscellaneous anti-cancer drugs are very much important, and the FDA approved drugs 2018 onwards. Most of the faculties will teach you the important drugs, but the drugs which are also important but not taught, so you go search FDA approved drugs. Just in the Chrome you give, or any browser you give, FDA approved drugs of dash year, okay, and you will get all the list of the drugs that were approved in that year. Now from that you have to see which all are important for the exam. Like in our exam came the trofinetide, which was approved for Rett syndrome. Since it is the first drug approved for Rett syndrome, so it was asked. तो ऐसा ही इंपॉर्टेंट डिजीज के लिए आस्क करेंगे. एकदम अनकॉमन सा कोई ड्रग हो जाए वो सब आस्क नहीं करेंगे. माइक्रोबायोलॉजी 12 to 18 questions approximately. Staining, here also staining is important, microscopy is important, sterilization is very much important. More of the general topics and the practical aspect. INICT focuses more on the practicals that you are having and the internship things rather than the clinical things. Bacteriology, pseudomembranous enterocolitis, nocardia, the smaller organisms like the rickettsia, arlechia, anaplasma, these are very much commonly asked. Mycology is the hot favorite. That is the chromoblastomycosis, porotrichosis. These are hot favorite of INICT exam, and they will go in depth of these topics. Virology, parvo B19, how many times I don't know. It is also important for the NEET PG aspect. Hepatitis virus, this is also important for NEET PG and INICT. Which antibodies will rise in which phase? This usually comes. FMT 6 to 9 questions. Injury images, Marshall's triad has been asked 3 times. Just a common question, and direct repeats 3 times. Drowning is important. Marbling has been asked 3 times. Sexual violence, criminal responsibilities of insane, POXO is important here. In ethics, the health related declarations has come twice. More important is the toxicology aspect. PSM very much variable, because in INI May only 2 questions were asked, so 2 to 10 questions is the norm. And main important is the biostats. Okay, focus more on the biostats, the graphical representations. Parametric, non-parametric test has come in number of times. What are the modes of representation, the diagrams, you need to have a hold on them. Kappa statistics has come twice. Okay, I am writing that, I forgot to mention maybe Kappa stats. In miscellaneous, vaccines has come. The vectors are important. Dog bite management is very much important. Which antibiotic you give was also asked in my year INICT, but I made it wrong. The answer would have been amoxicillin. ENT 6 to 8 questions, pretty predictable subject. From auditory pathway, I don't know how many years they would give questions. Approximately 7 to 8 repeats in just 4 years, past 4 years. एक गो पेपर में तो 2 गो ऑडिटरी पाथवे का क्वेश्चन था. मीन्स दिस इज देयर हॉट फेवरेट. So hearing is their hot favorite. And the general topics you all know, nasal blood supply is important. Rhinosporidiosis and the turbinates, the endoscopy view is important for both NEET PG and INICT. I, this is also variable because INI may approximately 12 questions were asked and all were difficult. And I tends to be a bit of difficult. I have seen this in INICT. Corneal ulcers are important, Best disease, diabetic retinopathy, pterygium, but many uncommon topics are being asked from the eye, like in our year, Petit Scanner was asked. Medicine, 12 to 20 questions. The ECGs and what are their management, that is the hot favorite of INICET. Acid base balance, hot favorite of both NEET PG and INICET. EBG, what is the procedure, because the procedures are being asked. As I said, it is more focused towards the internship and the practicals. You need to know the steps. After that is the tension pneumothorax, very much commonly asked. CKD criterias, hypercalcemia management. In hematology, TTP. Seizure management, that is, if there is 2 years of seizure free interval, no family history, you can stop the anticonvulsant. Like this kind of questions are asked. Stroke and TIA management are asked. The CSF findings of various meningitis are commonly asked. In infectious disease, COVID, dengue, and HIV are very commonly asked. Pediatrics, 7 to 10 questions. Milestones is very much important. Milestones is not important for the NEET PG aspect that much, but for INICET, it is very much important. Every year, one question is asked for milestones. Neonatal resuscitation, the SAM criteria, same criteria is asked 5 number of times. NADA's criteria, recently it is more commonly asked from November 23, it has been asked 3 times. Diarrhea and pneumonia management. In surgery, IV cannulas are very commonly asked. The sutures are very commonly asked. Trains, the instruments are commonly asked in the INICET. GCS, very much important for NEET PG and INICET because it is the basic skill that you need to know in your emergencies. In endocrine, papillary thyroid cancer, Men's syndrome are important. Perforation management from GIT, appendix, appendicitis, these are common topics. Important for the INICET aspect is the bile duct injury, which is a bit of difficult to remember the Strasbourg classification. Acute pancreatitis and the criterias, Ranson criteria and all these are asked. In breast, TNM staging, BCS, and the Van New score were being asked in AIMS 2017 and INICET 2022. TNM staging, which all TNM staging are important, I have mentioned in my PDF only. No need to do extra TNM stagings. Psoas abscess in OBGY, aneuploidy screening, physiological changes in pregnancy is very much important. PIH, stages of labor, drugs used to control postpartum hemorrhage, AMTSL, modified Bishop score. This is also very much important. Approximately 4 times it was asked. In gynecology, pap smear, because it is a procedure that interns usually do, so this is very much important. Types of ovarian cancer is very much important. Vulval cancer, endometriosis, semen analysis, amenorrhea is very much important. All the causes of vaginal discharge are very much important, and the Mullerian malformations very much important. PCOS management also important. Coming to psychiatry, a pretty low yield subject, but approximately 4 to 6 questions are asked, and they are mainly based nowadays on the addiction, because addiction is a growing problem in India. So mainly OCD, alcohol, smoking, all the criteria related to the dependence and alcohol consumption, these are important for the psychiatry aspect. In anesthesia, 2 to 4 questions, hardly 3 questions come, and among that also one question is from ACLS and BLS protocol. At a time, all the oxygen devices were asked when it was the time of COVID-19. So INICET sees the trend, which kind of disease is occurring and all. So अभी के लिए COVID-19 थोड़ा सा कम important हो गया है, and अभी CPR and ACLS BLS is more important. Orthopedics, 4 to 10 questions are asked. The dislocations of hip, giant cell tumor, approximately 7 times it has been asked. Types of fracture healing, fat embolism, patellar fracture is important. And angstpon is hot favorite, and osteoporosis also hot favorite. And you need to know the difference between the rickets and scurvy x-ray. Radiology also, it is asked in integrated fashions, and I haven't mentioned those which are integrated. So जो अनकॉमन चीज़ें हैं जो दूसरे सब्जेक्ट्स में नहीं कवर होती हैं, that only I have mentioned. Dermat, pretty focused on the previous year topics, 5 to 8 questions you can get. Acne management, the bullous disorders is very much important. Leprosy, very very important, because in India still we have a lot of leprosy cases. Vitiligo, the segmental vitiligo, they have asked in the recent INICET also. Herpes zoster is very much important. They can give the image in which ganglia it stays, that is the dorsal root ganglia, which virus causes it, what is the presentation, what is herpes associated neuralgia, these all they tend to ask. Psoriasis, all time important. Allergic contact dermatitis, which allergen causes which kind of allergic contact dermatitis. And regarding the patch test, it is very much important, because the first reading you take after 48 hours. If there is no reaction, you take after 96 hours. How to get this list? There are two ways. You can join my YouTube channel as a member, then you will get access to this list and other important PDFs that I provide to the members of my YouTube channel. And you can purchase this list. The link is given in the description box below. And NEET PG list is free for all. You don't need to purchase it. You just go to my Telegram channel. The link is given in the description box below, and check the pinned comment section. There only you will get the list. Now the most important video that you should watch is the NEET PG versus INICET difference, and you can see that how to solve MCQs. So go watch them now, and all the best for your INICET exam.